Learning from your mistakes is good, but learning from other people's mistakes is going to save you time. So learning from others' experience. This is where it's important for you to read the feedback statement. The feedback statement shows you exactly what are the common pitfalls and where you need to focus your attention. So when we look at data gathering and diagnosis, commonly observed that GP trainees, they don't take a sufficient history to enable a safe assessment. For example, if you're taking a mental health history, it's really important for you not to miss risk assessment. You want to make sure that you check whether there's any risk factors, whether there's anything that could lead to a safety issue. For example, if a patient is got alcohol dependence and they're driving, there's safety issue there. Another problem is where the structure is not there. So the history is being taken in a very disorganized way, and the candidate is jumping back from clinical management to data gathering, and it's just not structured. And this is where there is a risk for you to miss something very important. Last one I'm going to point out here is where candidates are not thinking about their differentials. So if a patient is presenting with low mood, sometimes you might feel like this is depression, and you're just asking about all these questions about depression, their sleep, their fatigue, or their level of energy, or their mood, but you're not asking other questions to find out whether it could be bipolar disorder, whether it could be anxiety, or whether it could be if the patient has got schizophrenia. So you want to ask a few other questions to show that you're doing a workup to exclude other differentials, so that you're not jumping to a conclusion too soon, thinking that this is depression. So in clinical management and medical complexity, there's 9 statements. So make sure that you read them and read the explanation details on the college website. So management plan relating to referral was inappropriate or not reflective of current practice. Let's say you've got a patient who is presenting with gout, and the patient would like to have a referral to rheumatologist. If you do that when it's not expected for a patient to be managed by a rheumatologist if they've got gout, then it's not appropriate. So it's important that you might have a difficult discussion with the patient to explain that this is not something that would be done. You can manage it very well in general practice setting. So you need to know what other referral you're doing, and also whether you're doing a routine referral or an urgent. If something needs to have a routine referral and you're doing it as an urgent, then that's not appropriate neither. So you need to know not just which specialty to refer, but also the urgency as well. The second one here is about prescription. So the management plan also needs to be related to prescription decision that you're making. For example, in the case that we've just discussed, where the patient was on amlodipine, on Ramipur, so their blood pressure is low and at risk of dehydration, you want to discontinue that medications so that the patient is not at risk. So it's important to think about what prescribing decision that you might need to make. And you can already think about it in the priming stage. What are your clinical management decisions that you might need to make? Another one here is not discussing the risk of your medical plan. So it's important that you help the patient to make an informed decision. If you're discussing a medication, for example, if you're discussing a medication that has severe side effects, for example, if you're prescribing a patient with Bixaban, you want to tell them about the risk of bleeding, because there might be implication if they have a fall later. So it's important that you discuss the risk appropriately without scaring the patient. And last one that I'm going to point is time management. This is really critical. If your time management is not on point, you're not giving yourself at least 5 minutes. Sometimes 6 minutes can be difficult, but at least 5 minutes to manage it, then you're going to rush and you're not going to do a good job in the clinical management. So this one is important that you look at not just in the clinical management, but it needs to be in the data gathering. Because if your data gathering is not targeted, you'll find that you're taking too long in data gathering, and that has a knock-on effect on your clinical management. The last domain is relating to others. So this one, I understand that some of the IMGs struggle a lot with this, where you find that your consultation is not flowing well, you don't know how to show empathy. It can be very difficult. But what examiners are looking for here is somebody who can show their human aspect, right? So it's not about like just going through a list of questions and being formulaic, but you want to show that you're understanding the patient as well and how you're going to respond as a human being. You don't want to sound robotic. So communication skills, including nonverbal, responding to cues, active listening, were insufficiently demonstrated. It's important that you analyze your communication skills. So how you come across, whether you're good at active listening and whether you're good at picking up these cues. Because in the exam, the simulator, if you haven't picked up a cue, they're likely to drop another cue for you to pick up because their role is to help you with it. But if you miss it again, then they might not actually drop another cue for you. Then you might miss the whole heart of the case. So it's important that you actively listen. The next thing I'd like to point your attention to is ownership or responsibility for decision-making was inadequate or inappropriate. Sometimes I've observed GP trainees feeling like they need to give options to the patient. And some of the options they give are not good options. So if you are discussing with the patient who needs to have an admission, you're just saying, we could treat you with some medication at home, or we could admit you. Which one would you like? So this is not really a good way of discussing it, because as a doctor, it is your job to provide the best care for the patient. So if you're giving option to the patient when you know the best recommendation here would be for an admission, then you're not taking responsibility of the decision making. So the way you do that is to explain to this patient, I understand that you don't want to go to hospital because you don't want to leave your wife on her own. However, I am concerned about your health here because you're not able to drink, and I'm worried that you might be dehydrated. So that's why I think it would be important if we can get you seen in a hospital. What do you think? So you see, I am allowing the patient to make an informed decision. I'm giving this patient opportunity to contribute to the management, and I'm also making sure that I'm giving him the best care. But if I just said, we can do this or we can do that, which one would you like? That's not taking responsibility. So we've covered introduction to the MRCGP SCA, challenges and pitfalls of the SCA. Now we're going to look at how to prepare and how you can pass your exam. So a quote that I'd like to share with you is, we don't rise to the level of our expectation, we fall to the level of our training. So this is a very important concept. If you're going to sit an exam, it's not a good idea to just hope that on the day of the exam, you will somehow be able to consult within 12 minutes if you haven't been practicing at 12 minutes, if you haven't been doing these difficult, challenging cases. So when you've done the difficult cases, the challenging cases, you make sure that you are consulting within the time constraint, then whatever cases you might get on the day of the exam, because you've trained hard and you've been able to go through various challenging cases, then you will fall to that level of training. So I hope that makes sense to you. So let's take a look at what high performers do to score well in the exam. They plan early. They make sure that they take the exam seriously, and they give themselves time to plan and prepare early on so that they are not rushing their preparation. They develop self-awareness. They're aware that they are not everything that they know, so they're aware that they might need help. They also foster a growth mindset. This is where they're always learning from other people's experience, learning from other mistakes so that they don't make the same mistake. And that can save them a lot of time and energy. They also understand what examiners are assessing. So they study the exam. They don't just read what's on the website, but they digest it and they understand from an examiner's perspective. The high performers tailor the revision to address areas of weakness. Some people might know their areas of weakness, but they shy away from these areas of weakness. Whereas if you want to score well, you need to tackle these areas. And this is really important. High performers, they're not afraid of feedback. Sometimes it can feel uncomfortable to get feedback, to be told that you're not doing something well. However, high performers understand the value of feedback. They know that feedback is valuable for them to unlock new things in the consultation that they might not be aware of, identifying the blind spot or shortcomings so that they can develop. So not only do they accept feedback with open arms, but they reflect on the feedback and they're learning how they process that feedback. And high performers, they're able to consult effectively within 12 minutes. They've done it so many times that they have got the strategies to consult within 12 minutes. They made sure that they embed good consultation practice and develop their own style. So it takes some work to do that. Once you've embedded good consultation practice, it comes as second nature then. Under stress, you will still be able to consult well because you have got that good habit. Whereas if you've got these poor habits of not consulting well, then it's going to be more difficult. You have to unlearn that first and then learn the good habits and embed the good practice.